Dr. Smith, physical therapist here, and today I'm going to answer the question, can new graduates do home health? This applies to PTs, OTs, and even speech-language pathologists. So, can new graduates do home health? You've always heard, no, they can't. Oh, you need 5 years of experience. First of all, that is a flat-out lie. There's no state mandate that says that. I don't know where that came from, but it is not true. New grads can do home health. However, my personal advice to you is it depends on your clinical experiences. So if you've done any sort of clinical lower than outpatient physical therapy, acute care, sniff, etc., then yes, you can do home health immediately out of school because you know what they're like at a lower level before they are discharged home. And say for some reason they got kicked out of the sniff because of insurance purposes, you've already worked with them at that low level, so you will be okay. Now, if you've only done outpatient and you just want to dip your toes in it because you heard it pays more, then I recommend you really find out what you want to do and try it out a bit. One way I would recommend trying it out is going to a staffing or contract company first and just doing pay per visit, pick up the extra ones. And the reason I would say go to a staffing or contract company is usually they're therapist owned and run, so you're going to have more therapists to talk to, bounce ideas off of, than if you go to a Medicare certified agency. You might be the only therapist there. It might be a bit harder for you starting out. A lot of us that work at agencies now actually started out at staffing companies and then transitioned over once we realized we can make more money. So it's always an option. Again, staffing companies aren't bad if they're transparent with you, tell you what they make, tell you what they're going to pay you and why. If you get a full transparency from any company, then it's going to be a good fit for you. And again, you want to try going PRN, pay per visit first, just to make sure you like it before you sign a contract and get into something you're trapped. And then I also recommend if you know any other therapists, maybe shadowing them for a day, doing a drive along, no matter who you are. All right. So what is the most common questions that I get from new grads about home health once they decide it's for them? Well, right now there is the patient-driven grouping model happening to home health, which is going to affect January 1st, 2020. It's very similar to the patient-driven payment model, PDPM, that's happening in SNFs, that's happening in October 2019. So what's happening is, for about 20 years now, therapists have committed a lot of fraud because the reimbursement was therapy-driven. Now, because of this, Medicare is like, hey, we're losing a lot of money to fraudulent agencies and therapists committing fraud, or therapists being driven to commit fraud due to productivity demands by administrators and so on. Basically, whatever you see that's broken in healthcare, Medicare is actually trying to fix it. So what's happening is it's actually going to go to more outcome-based care. So you're going to get patients better. If you get patients better faster, your agency will get paid a bigger sum of money because you have better outcomes. And what's going to happen now is those therapists that kept patients on for a whole year for no reason in certification periods, now they're going to be exposed and Medicare audits are going to happen. However, if you are not getting patients better faster, that should get better in about 3 weeks, then you're going to be exposed as well. So basically, this patient-driven grouping model, it's going to match the number of therapy the therapy need to the patient diagnosis, and say it's a general fall risk, they can get better in 2 visits. Say it is a serious stroke with Pusher syndrome, then you better hit that 13 visit mark. So it's going to be interesting how it plays out, but basically, if you just do what you were supposed to do everything that's clinically justified, you will be okay and you will succeed in home care. And if you continue to get patients better faster, then your agency will make more money and you should make more money as well. Now, mentorship. Mentorship can be done in many forms. There's a lot of information out there on mentorship. You can either call a professor, you can talk to classmates, not to self-promote, but I do have a course on home health mentorship. And that's just, those are the options out there. However, you can just join a Facebook group. You can post in any Facebook group, ask questions, and that's really for mentorship. I mean, I really recommend that you go for a ride along, you ask questions, you post in Facebook groups. There's a lot of Facebook groups out there, not even including my own, that have a lot of therapists. There's travel therapists, there's OTs, SLP groups that have 18,000 people. There's a Doctor of Physical Therapy students group. There's so many groups out there that if you just ask around, it should help you, maybe help you get some ideas you haven't thought of before. And don't be afraid to ask questions. At any time, you can reach out to myself or anyone else, and I'm pretty sure we'll be happy to help you. All right, and then EBP, evidence-based practice. A lot of people think that home care is where dinosaurs go. Now, there is a lot of shit therapy provided in home care. I saw this coming into the home care as a new graduate, and right now I'm actually in charge of 2 counties because the other therapists just honestly kind of suck. So make sure that you're reading literature, make sure you're being up to date with information on what's going on with certain neurological conditions. Even it comes down to patients with epilepsy. Make sure you're educated on the ketogenic diet. Make sure that you're educated on as much medical information that you possibly can. And then also at the same time, make sure that if it makes sense and it's clinically justified and you want to try it, go ahead and try it out, okay? Again, this video is going to be a bit shorter than my other ones, but things for new grads to consider are LUPA. So in 2019 and in 2020, a LUPA is a low utilization payment adjustment. So right now, this is 4 or fewer visits. So say I go see a patient that gets better in 3 visits. Well, guess what? We have to give some of that money back because we're now in a prospective payment model where they think they need this much therapy. Here's a lump sum of money from Medicare. You see less than that amount, you don't utilize all of it, you have to pay it back. What's going to happen in the 2020 models is that it's going to depend on the diagnosis. So like I said, if it's a fall risk, you could do 3 visits and it's no longer a LUPA. However, if it's a stroke with Pusher syndrome, you only do 3 visits, then it's a LUPA again. It's going to be really interesting to see how this plays out. Ultimately, if you don't understand the system, you don't understand payers, you don't understand administrators, then you're going to get left behind. You're not going to make as much money because you're not generating the agency as much money. And going into your interviews, whether you're a traveler, whether you're just interviewing for a regular job, going part-time, make sure you know these payer processes, processes, I don't know. Just make sure you know these because these were probably not taught to you in school. And if they were, you probably fell asleep. But once you understand insurance and billing and payers and payees, you will set yourself apart from the competition. I have personally helped new grads get over $115,000 at full-time jobs, and travelers make over $120,000, and those transitioning make $100,000+ just by understanding these principles and bringing it up in interviews. Know your worth. Know that as long as you continue to provide value and continue to know that right now your license does bill a certain amount, going into the new year, it's going to be a cost like nursing. Know that you are a cost because you are valuable, and so are the services that you provide. Clinician safety is another question I get a lot from new grads. So if you do not feel safe, do not put yourself in harm's way. Okay, remember, most of these patients are homebound and very deconditioned, but always be aware of your surroundings. If you're a small female and there's like a big male that's saying inappropriate things, call your agency, call your director of nursing, call your director of rehab. Get out of there or just don't go in there. Respect yourself, respect your limits. The earlier you put your foot down, the less you're going to get walked all over. Other examples are aggressive animals. I've almost been bit by a dog twice. However, that was a rare case, and I just jumped out of the way, not going back to that house, and totally agreed to put their dog away. Drugs, I have seen drugs in home care. I've walked into the houses in the hood. There's a lot of cocaine on the table. I mean, it doesn't bother me, but if that bothers you, get out of there. Feeling uncomfortable, again, if you don't feel safe or uncomfortable, you feel like you're going to get stabbed, you feel like you're going to get attacked, you feel like somebody's going to grab you, don't go in there. Another time I felt uncomfortable is there was a rattlesnake on the patient's porch. I decided I'm not going to get bit by a rattlesnake today. All right, aggressive family members, as again I said, again, a lot of this is rare and most likely never going to happen. But if it does, don't risk your personal safety to make a visit that's going to generate the agency a few dollars. All right, is that worth your life? Probably not. And then again, bad weather here in Florida, such as hurricanes. Nobody needs therapy during a hurricane, so don't go out during a hurricane or a storm. So again, don't put yourself in immediate danger based on anyone's request. If your employer threatens to fire you or anything like that, make sure you screenshot that text or record it, and make sure you report it to the authorities appropriately. Discharge planning is another question I get. This is more for those already experienced in home care, those that have started traveling in home care. Basically, you want to talk to your PTAs, your CODAs, if you're an OT prior to the DC. Also, you should be attending case conferences and discussing your patients with social work, with RNs, with your director of nursing. If you're the director of rehab, then go ahead and do that. You want to, so that way you and your patient know what to expect. Also, your clinical team knows what to expect, and scheduling knows what to expect, and so on. That being said, if the patient, say, is no longer a taxing effort to leave the house, but they just don't have a car, then maybe you can refer them to somebody that provides Part B services in their home, or set them out transportation to an outpatient clinic that may provide transportation services. Or you could even start your own Medicare Part B company and refer to yourself that way. However, make sure you know the legal ramifications of that and you do everything clearly, but it is an option if you want to make some extra money as well. And then also for discharge planning, make sure you know the most appropriate functional scoring test. I know I posted the diagram of this, I believe, in my Facebook group for the Home Health Mentor group. It's in there for free, or you can message me, I'll send it to you. But that way you know that, if the patient's super chair-bound, use a Tenetti, but if the patient's not chair-bound, it's not evidence-based, and you probably want to use a Berg. All right. So make sure you show improvement from baseline. That way, when you DC them, you can justify that they've reached their max level of independence, or they are at or above the prior level of function. So again, can new grads do home health? Yes, this may have been a lot to take in. Make sure you review all of this. If you want this document, I'll post it in the comment below. If you have any questions for me, comments, complaints, concerns, again, I'm Dr. Smith, physical therapist, and I'll respond to you within 24 to 48 hours. Just make sure you comment below or send me a message. All right, thank you.